thank you for coming. This is my first State of the College address. I think it's a great opportunity to take a broad view of where we are as a college and look at all the things that we do. It's been exactly 6 months to the day since I transitioned from dean to the president's office. And I can tell you that over those 6 months, a lot has been happening. I am pleased to report that the state of the college is strong, and we continue every day to fulfill our mission to lead in education, research, and patient care. I've been asked frequently about my vision for the college, and the simple answer is that we will be leaders in everything that we do, and we will lead by example. Now, because I'm not a clinician, and I've been trained as a vision scientist, I've also been asked on many occasions what my vision is for the college and who we are, who we will be. And I have to say that I feel that that's not a good question, because it's not an either or answer. We obviously are both, and we are so much more. So I'd like to just say, in answer to that question, who we are, and hopefully, I won't be getting that anymore. We are career builders. We create and mentor optometrists, vision scientists, and our faculty. We are innovators and researchers. We do the research that unlocks the mysteries of vision and drives the profession for the benefit of our students and our patients. And of course, we are eye care professionals. Through the clinical networks and the reach of our graduates, we serve the eye care needs of many thousands of patients across the country and provide eye care for all who need it back here in New York. I feel strongly that by combining our educational and research efforts to improve patient care, we enhance our institutional reputation and maximize our impact on the profession and our patients. So, over the past 6 months, we've prioritized creating a seamless administrative transition while addressing the needs of our students, faculty, researchers, and patients. I just want to highlight a few of our institutional priorities that we've been focusing on over the past 6 months and will continue to work on for the next 6 months. And first and foremost, we will complete the search for the next Vice President and Dean for Academic Affairs. We should have that person in place, hopefully, before the beginning of the next academic year. We will develop a new 5-year strategic plan for the college. We've been working on that for a while now. We have a major survey that's been broadcast to the entire college community, students, faculty, and staff. We are also sending it out to our stakeholders, the College Council, the SUNY College Foundation, and others. And we hope that you will complete that survey because it will give you some voice in the process. I think the due date is March 7th. We're looking at extending it a little bit longer, but please take the time, if you haven't already, to complete that survey. Many of you will also be engaged in the weeks and months ahead to take part in that process. And so I encourage you to please reach out to those organizing working groups, and we'll complete that process and have a new strategic plan that will provide a guideline for the college's priorities in the years to come. Another thing that we are doing currently is to try to strengthen our partnerships with the NYSOA and the AOA, and also engage our alumni population. So we're trying to do that to help us, help guide us in the future of the profession and concentrating in different areas that we can excel in, including scope of practice. We're looking at increasing scope of practice. And I'll come back to that and give you a little bit more information in a few minutes. The gorilla in the room, really it's an elephant in the room, is how we're navigating certain political uncertainties. There's been a flurry of activity coming out of Washington through executive orders and actions, and many of these have direct impact on us. And so we are very carefully looking at that. We're reviewing all of these actions as they come out. We know that they can affect, and they are already beginning to affect, our grant funding, our research support, and our DEI programming. We're watching this very carefully. We're actively working with the SUNY system and the Office of General Counsel at SUNY system, who in turn are working with the Attorney General's office. And we're looking at ways that we can respond to some of these actions in a coordinated way. I will touch on a few of these areas in my remarks that follow, but for now, just know that we are resolute in our mission to educate eye doctors, conduct research, and that advances eye and vision science and provides the best eye care to our patients. And so under that umbrella, we will be able to weather this. And it's a complex, ever-changing situation. A lot of these actions and orders have already been stayed. Some of them are in court. The constitutionality of some of them are being reviewed. So it's an area that's in flux, and we're watching it very carefully. So in each of the college's major areas, there's been a lot of activity. Several priorities for 2025 have been identified, and I'd like to highlight a few of those, and I will return to some of these in the remarks that follow. So academic affairs will continue to do what academic affairs has always done, and that is review our courses and develop our curriculum. Academic Affairs is also working really diligently on clinical preparation programs. We've been looking at the way our students are moving from basic training in clinical skills to clinical, seeing patients in the clinical setting, and then beyond that into the boards. So we have programs that we're developing there. Board preparation programs in general are an important thing that has been looked at in academic affairs. And obviously our biggest task ahead of us is the creation and opening of the Upstate Optometric Extension Program. And so I'll tell you a little bit more about that. I'll give you an update. That's due to open a little more than a year and a half from now. In student affairs, we are reviewing our admissions process, in particular to prepare for the upstate expansion. Student affairs is currently working on C-STEP funding renewal, and I'm pleased to tell you, and students among you, that we will be administering some new presidential scholarships for our students in the year ahead. So we're working on the structure of those scholarships and how that's going to, how they'll be allocated and how it will work. Research and graduate programs are active. Obviously, one of the major areas is to grow translational and clinical research efforts. There's new lab construction. There's 2 new tenure track faculty positions that are undergoing a national search, and we're organizing a faculty research retreat for some time, perhaps in the summer or fall next year. So stay tuned for that. Some other areas, patient care in general is looking to grow the UEC services, open some new, the brand new primary care clinic on the 7th floor. It's spectacular, and if you haven't seen it yet, you're going to be blown away by that. We will complete our design for the vision rehabilitation clinic. That'll be next up in terms of clinic construction projects. And I hope that our clinical faculty are happy to hear that we are planning to add 3 coders and 3 primary care clinical support specialists to assist our faculty and improve efficiencies in the clinic. Institutional advancement has been busy. We've launched a new campaign, Seeing the Value of Vision. We will be building on that campaign in the coming year. We'll increase alumni engagement. That's a high priority for everyone. Our alumni are our extended family, and so we want to make sure that they're connected and heard. We are developing new marketing strategies to increase the college's visibility, and it'll be based on our reputation. So we're going to try to highlight all the things that we do and improve the visibility of the college. And of course, marketing the Upstate program, particularly for student admissions, is really important. So that'll be a priority. Finally, administration and finance. It's an amazing part of the college. Many of you may not work with them very often, but they're there and they're doing all kinds of amazing things, and they enable us to do everything that we do. So they'll be continuing to work on capital construction, renovations around the school. I'll mention a few of those as I go through the material today. And then, but their main job is to maintain us in a strong financial position. And I can tell you that we are in a strong financial position. So our revenues from all areas have grown since COVID, and they are remaining steady. You can see on the slide here, don't worry, here's COVID, this dip here, and that dip is associated with a drop in state funding for that year, which then later came back and boosted us up. But we've been steady now, and we're around $40 million a year in total revenue. So you can see that a lot of the growth in our revenue is in research, 43.9%, 44% since pre-pandemic levels. Patient care has gone up by about 14%. This is tuition. We've kept tuition from going up too much by raising these other revenues. So students, we're always trying to keep tuition revenue down, but tuition is a very big part of how we fund the college. As you can see, it's around $13.3 million a year. And then finally, our state funding has grown about 12.7% since pre-pandemic conditions. All of this has put us in a very strong fiscal position. Many of you are familiar with this slide. Dr. Heath used to like to show this slide, and it basically shows our budget, both in terms of revenue and expense. And you can see that at the end of this year, we're predicting, again, a balanced budget. We've been balanced for a number of years. The COVID period really kind of put us into a whipsaw of activity here, but we're stable and we maintain a balanced budget. You can see that our revenues have gone up several times over the years. They've also gone down because of reduced state support, and state support is really what drives our fiscal state. In this period here, in the 2015 or so and up to around 2018, we had enrollment expansion, and that drove our revenue up. So that was a major reason for going up. COVID, then COVID, the stabilization after COVID, and here in the last year, we had the first major state support increase of a little under $2 million, and that put us in a surplus condition for 2024. But we're predicting going back to a balanced budget by the end of this fiscal year. So because we're in good financial state, we have the ability to increase our fund balances. This is like our savings account for a rainy day. And you can see here's COVID again. This is what happened with COVID. Because state support dropped, we relied on healthy fund balances that we had in the bank to cover our expenses through that period. But when state support returned, our fund balances went back up, and now we're running at about $23 million of fund balance. And that's an opportunity fund above and beyond our safety security funds. Right? We want to make sure that we have about $15 or so million in the bank at any given time to weather any fiscal problems. But because we're above that, we have some opportunities. And based on our projections for this coming year, we can initiate the upstate program, we basically get it off the ground until tuition starts coming in, and in a couple of years, that should cover those initial costs, which we estimate to be between about $1.5 and $2 million to just get it off the ground. We're also using these funds to kickstart our UEC support staff that I told you about a moment ago, the coders and the clinical support specialists. And then also, it's how we will provide some increase in presidential scholarships. So this is our budget based on revenue and expenses in the college. We also get funds from other sources as well. So the researchers who are out there who get grant funding are also generating monies for the college, and that's not included in this fund balance. Neither is the foundation funds. Our college has a foundation which raises money for the college. That's also separate from these funds. So we're in a pretty good position because our research activity, as you'll see, is strong, and also our foundation is healthy and strong as well. So in 2024-25, the current fiscal year, they report assets of about $14 million. They've had revenues. They've increased those funds by about $4.6 million. And 1.5 of it is from new grants and contributions. So when you donate to the foundation on Giving Tuesday or through payroll deduction or whatever else you're doing, that's the money that's going into that account. Those funds are also, the assets are also generating earnings. And so we've increased the assets. We've had good years the last couple of years in the stock market, and we have about a $3.1 million increase in that revenue. Now, that's the revenue side. The expense side is about $1.6 million. So that's what's spent out of the foundation every year. And about $420,000 goes to scholarships and student support. The rest of it goes in some areas of such as access to care, helping patients get patients from underserved areas the care that they need. We're also having clinical support. We also have research support. So 1.6 million a year, and that only hopefully will go up. So what I'd like to do now for the remainder of the time is to hit some of the major areas of the college and talk a little bit about what's going on in those areas and some of the priorities. So we're all familiar, and I'm not going to go into this in great detail, but our education programs are a centerpiece of what we do. We have optometry programs. We have clinical training programs that are related to optometry, but also residence and continuing professional education. And then, of course, we have our graduate programs and our research programs. So they're very active. I'm going to save a little time by not going through this, but you can see that there's many elements to all of these programs. Our education programs are driven mainly by student admissions. And we are currently at class sizes of about 100 each year in the optometry program. And that puts us around, at this level, about 400 students per year. That's gone up. This was our period of enrollment expansion in the mid-2010s. Prior to that, the college has always been hovering around 75 or so students per year. So this generated a lot of revenue. The revenue that it produces from tuition can be added to our basic revenue stream, and we keep, by adding students, we can try to keep tuition levels down. When we opened the upstate program, we were first going to have about 16 students in a class up there, and that over 2 to 3 years, and then that will expand to 32 students. So as that goes up for all 4 years, that's going to raise our total enrollment to around 132 students per year. Our admitted students coming into the program continue to be strong. On average, what this graph is showing, these are the average undergraduate GPAs of our incoming students. The national average is shown in red. Our data are shown in blue. All these gray lines are other schools and colleges of optometry. And so our students for the class of 2024, the current first year, the class that entered in 2024, first year, has a incoming undergraduate GPA of around 3.7 compared to the national average of about 3.56. The OAT scores for SUNY students are on average very high. We're third in the nation at 342 average OAT. That's a nice number. We know that students that are coming in with that, that's a good predictor of success in our program and success in the boards. Remember, these are averages. So we have many students are above average and some students are below average on this metric. So it's important when we look at our education performance and student performance, we look at completion rates and attrition. And we have generally good completion rates and low attrition, but there's always room for improvement. We would like to have 100% of our students complete the program on time. We don't always have that. And you can see the incoming number for each class is shown in the blue bar. The red bar is how many have completed on time, which means in 4 years. Some complete in 5 or more years, and then the light blue bar indicates the students that have withdrawn or been dismissed from the program. So, as I said, currently we have very good completion rate and low attrition, but we want to do better. So how can we do better? Well, we do better through academic programs, such as the Center for Teaching and Learning. Now, the Center for Teaching and Learning has been under development for a few years now, and basically it took all of our student support programs, academic support programs, and some of our wellness and mental health programs as well, and put it under one umbrella. And that's led by Parvati Chitoli with this great team of women who are assisting her with the program. The program is a collaboration between academic affairs and student affairs. It's where students and faculty can work together in an active learning environment. It enhances teaching with evidence-based pedagogy and technical integration. It promotes student success with support services and educational enrichment programs. And it fosters student and faculty well-being through health and wellness programs. So they've been working quietly because it's not officially open yet, but it will be officially opening sometime later this spring. So stay tuned. Hopefully it will be in the next month or two at the latest. Another important measure that we're always looking at is board performance. Now, we are generally strong in board performance. We tend to be toward the higher end among the colleges and schools of optometry. So we're above average, but there's always room for improvement. So the way to quickly look at these data, and I know it's complicated, but the red here are the national averages. The dotted line is a rolling average. The blue is our performance by year with a rolling 3-year average as well. So you can see we've always maintained higher than national average pass rate, first-time pass rate on part 1 and part 2. We've seen some dips in the last couple of years, but these dips have also occurred in the national average as well. So we think this is a complicated area to really analyze. A lot is going on here. And we think that there's been a COVID effect. So students that went through college in COVID or went through the early part of our curriculum during COVID have had a difficult experience, and that may be an effect. But there's other things going on. So we're constantly looking at predictors of success. And one of the strongest predictors of success, and I'm very proud of this fact, is that GPA and performance in our curriculum is by far the best predictor that we have for success on the boards. We also looked, by the way, at in-person attendance, and that has a much lower predictive effect. So students that are not attending class, and I probably shouldn't say that, and I can see Dr. Nguyen looking at the corner of her eyes at me. That's not to say that you shouldn't come to class, because coming to class has all kinds of additional benefits. But we know right now that by far the best predictor of success is performance on our curriculum. From an admissions perspective, it's the OAPs, it's the optometric admissions tests. And scores of around 340 are a very high predictor of success on the boards. So we're working, Academic Affairs has been working on study strategies, creation of study guides, and the GAP exam. We've put so much work into that. There's a number of people, a number of faculty that deserve credit for this. I know Dr. Nguyen, Dr. Putnam, Dr. Beaton, and I know there's others who have worked really hard on providing that exam to our students, and that's a way that students can practice exam board type questions and also identify gaps in their knowledge. And then lastly here, this is the percent of our candidates in a class who have passed all parts of the boards by graduation, and we're always well above the national average in the 90s. So our educational programs, preparation for the MBEO, also reviewing the clinical education, and that includes, importantly, preparation for part 3 of the boards, the clinical part of the boards. So that's where that's a new exam. This year, it's called the PEPS exam. It's a completely different exam from prior years. Our clinical education department and our faculty have been working really hard to prepare our students and to anticipate the kind of experience they have on the PEPS exam. So many thanks to everybody who's worked on that. I know that there are many of you. I know Dr. Sullivan, me. I see Dr. Canello. So I know that there are many people that have worked on that. So I apologize if I didn't name you. In general, just preparing students for expanding scope of practice while also without losing their basic skills that are necessary for general practice optometry is really important to us. So we're trying to find the right balance for that. and all of the other things that we talked about already. Admissions review for expansion, curriculum review, course development, officially open the Center for Teaching and Learning, and of course some renovations to existing teaching space. And I want to really quickly point out a couple of things. So this is the 11th floor. So those of you, this is all student affairs up here on the south side. The north side is over here. This is residency offices and programs, and this is the Department of Clinical Education. Everyone knows the classroom on 11, it's 1118. That whole space with the kitchen is going to be renovated. And so it doesn't look like much, it's a bit of a box, but it will be all brand new with new AV and a brand new kitchen. And this is going to start later this spring, and it'll be worked on over the summer. It may impact the scheduling in the fall, but it should be done sometime in the fall, late fall at the latest. Another major project that's in design phase this is the 15th floor. Here's the faculty lounge area. These are the labs on the 15th floor. This whole space is under design, and we don't have exact dates yet and when this will happen, but what we'll be doing is we'll be creating new teaching labs and conferencing space. Okay. Now I want to talk a little bit about research. Our research programs are strong. We are leaders in research nationally among the colleges and schools of optometry. There's lots of ways that is measured. Here is one of them, and you can see that we are second only to Berkeley, University of California, Berkeley, in terms of the total research funds awarded annually. So we were awarded more than $5 million, $5.2 million. Berkeley is doing well with $9 million, but they're a major research institution and much larger, and they draw on a number of departments outside of the College of Optometry. But we are number 2 among all of the other major public universities where there are colleges of optometry that have significant research efforts. So we're looking really good in these terms. Another way to look at this is in terms of the cumulative amount of research dollars that we hold at any time. And today, in fiscal year 25, we have 47 grants that have been awarded for a cumulative total of about $14 million. So that's down actually a little bit from last year, when we were about 16.2. And what that reflects is the ending of some major grants. But nevertheless, we have $2.3 million of grant funding in the pipeline that we're looking at hopefully getting funded. Although things are now, we have some awards, we have some really high scoring awards that seem to be stuck at the NIH because of the budget uncertainties that are happening there. So right now, a lot of things are sitting on hold, and a major thing that it could be a potential problem for us is that associated with this grant funding are something called overheads, indirect. They're also known as indirects, or they're also called facilities and administrative costs. And for every dollar of federal funding that we bring into the college, 63.5% is matched as overhead. If that was recently cut by the NIH because of an executive action. Now, it's fortunately been put on hold and it's being reviewed in court, and we don't know what's going to happen yet. And I'm sure that we'll continue to get something to support our research efforts, but it could be cut from, the proposal was to cut it from 63.5% to 15%. And if that happens, based on last year's expenditures, that would that overhead of $1.1 $1.13 million would be reduced significantly by a gap of about $800,000. So that's a significant gap that we'd be suffering. So hopefully that will not take place, but we have to be prepared for it. And so we're looking at ways of making up that gap, filling that gap. In general, and then this is just more of the same, this is our actual expenditures, and what this means is of all the funding that we receive, how much is actually spent in the fiscal year. And it's not as high as the 5 million, it's closer to 4 million. So people that are doing these research grants are having their own little reserves put aside that they can push into the following year or use when the other funds have reduced. So we've got to be careful about this, but our annual expenditures have been around $4 million for a few years now, and hopefully they'll remain around that level. The Clinical Vision Research Center has been an enormous benefit to the college since we've opened it a little more than 10 years ago. There's been 113 studies in the CVRC since it was founded in 2013, and it's growing. We have, on average, about 21 studies per year going on there. These are studies that involve patients as participants, and they're studies that are aimed at improving the care that we provide in the clinics. The total number of enrolled and active patient participants has been close to 4,000 people that have worked there. We're consistently high in our study enrollment, which makes us really attractive to funding agencies. We fund at between 64% of our target and as much as almost double what we've targeted. So we're in a very good position there, strong. We have distinct funding sources. Some of this is NIH, but there are others. So we have a total number of different funders of around 35. The number of principal investigators involved in the studies going on are around 24. The CVRC employs about 3.6 FTE. These are coordinators and optometrists that are just completely doing research. In 2024, the revenues were about 1.4 million, which is basically, it's more than 25% of our total research portfolio. And so the potential income of the new applications coming in are around $5.1 million just for the CVRC. So this is an area that we can grow, we can have great impact. It's going to impact our reputation, it's going to impact our students, and it's going to definitely impact the profession and our patients. This is just summarizing everything I just talked about, so I can skip through this, and I wanted to just point out some new construction here. On the 16th floor, many of you may or may not have been on the 16th floor. In the old days, this used to be teaching laboratories, which we've since moved to 15. But we're renovating all of those old teaching laboratories to be research space that could generate more funding and more activity. So this other space back here is all research labs at this time, and we're going to be adding those labs as well. This is about a $5 million project. We're going to be breaking ground on it hopefully this summer, and it should be completed sometime in the late fall of 2026. I keep wanting to ask if there's questions. I normally have engagement with folks. For one thing, you guys seem like you're a mile away from me, but for another thing, I do want to complete this, and I have about 10 more minutes. Let's turn our attention to patient care. So patient care is what the college was founded on, okay? And our clinic, our owned and operated clinic within the college, is the University Eye Center. And this is just to give you a quick snapshot of what the University Eye Center is doing. So in 2024, there were about 57,000 patient visits. 25 of those patients were new patients. Approximately 15,000 were referred through our referral center. The UEC generated revenue of about $6.6 million. They carry a $3.4 million cash reserve. That's opportunity fund for the UEC, make sure that they can cover the expenses at any time, depending on any exigency that could occur. The payer mix, the patients are often self-paying with their own patient responsibility for elected procedures. 28% of the patients here are on vision plans, and there's other sources of support as well. $229,000 a year are allocated for charitable care. A lot of this money comes from the College Foundation, and there are over 1,000 encounters. So it's serving at least 1,100 people that couldn't afford the care on their own. The UEC, as we all know, is a large clinical operation with a lot of moving parts, so there's a lot of challenges. Faculty and staff recruitment and retention are among them. So we're constantly looking at this, and we'll continue to look at this. Compensation, flexibility in scheduling, and support. The new positions I mentioned are part of that support. The payer contracts. Their payer contracts are being renegotiated now. Reimbursement rates are being renegotiated now for the first time in a long time. Hopefully that will go well and help the bottom line. Healthcare technology is changing, and we're trying to keep up with that, but it's expensive. Looking at the infrastructure and the support that we need for the clinics is constantly being done. And take, for example, the EHR. So using AI to help with the charting. We're looking at that and how to support that. We're also looking at mobile solutions, so doctors can access charts and modify charts remotely and still do it with security. The revenue cycle, trying to get the money that the patients, get the money from the insurance panels, get the money from the patients is really important. So training and the coding is critical for increasing our revenue. And then finally, access and engagement for our patients, making it easier for them to make appointments, either whether it's through the website or whatever, just making their access to the clinic easier. So all of these things then are priorities. These are the challenges, but they're also similarly the priorities. So we're looking at all of these carefully and trying to come up with solutions. I'll jump ahead to the capital projects going on there, because we know that our biggest project that we've done in many years has been the primary care floor. We're also looking at the vision rehab floor as well. So the primary care floor, you've seen this old floor plan, but that floor plan has become reality. We have a grand opening of the 7th floor on March 25th. It really is beautiful space, brand new equipment, pre-testing, great space for the optical. It's going to be beautiful, and hopefully people will really love working in it and going to it. The 5th floor rehabilitation project is still in design phase, and we will continue to work on that and get to start to evolve the design and try to get this done in a way. I don't have any dates for you, but it's going to take some time, but it is a priority. Lastly, beyond the UEC's walls, we also have the satellite clinics. And our healthcare development, our director of healthcare development is Dr. Richard Soden. And there's a lot of activity there. And we have partnerships with 13 sites and employ 32 ODs at those sites. And our revenues for the program in these satellites is about $5.5 million. Dr. Soden has just recently finalized a 5-year contract with New York City Health and Hospitals, which is basically giving us access to 7 community healthcare centers. Woodhull Medical is up next for a new contract. At the same time we're having these contracts, we're also establishing scholarships and educational opportunities, and we have currently 5 community health centers around New York State. And then finally, we recently secured a $400,000 grant from Lavelle Foundation for the Blind to partner with the Syracuse Community Health Center, and this is one of their exam lanes. And we will be working with Syracuse Community Health Center as a possible site for our upstate students when they hit 3rd year and they're going into some of the clinical training. Which brings me to an update on upstate. And so the SUNY College of Optometry at Upstate Medical University is getting closer and closer to reality. After a national search, we hired Sarah Gleason back in, I guess it was, Sarah, maybe last June, July, and she will be the founding director of this new site. So just to give you a very quick sense of what we're looking at, this is the campus activity building as part of the campus at Upstate Medical Center, Medical University. That's where the optometry program will be housed. And yes, these are our tennis courts. There's also a pool and a gymnasium and weight rooms inside this building. The building is located conveniently close to ophthalmology department, which is about 3 or 4 blocks away. And that's where a lot of our clinical training will be taking place in collaboration with the ophthalmology department at Upstate. So all of this is underway. Here's within the CAB building, there are designs now that have been accepted, and we're in the process of getting ready for bidding for construction, and hopefully that will happen in the next couple of months, and construction will begin sometime later this spring and be completed about a year from now, in time for the first class to enter in August of 2026. The timeline is tight, but Sudeep and Sarah are on top of it, and everybody is working hard for us to make that timeline. You can see that there are 2 floors here on the 2nd floor, which opens to the tennis courts. We've got 2 16-seat classrooms, offices for administration and faculty, and a multi-purpose laboratory. Below, on the floor below, we have our pre-clinic, which will be 8 lanes. There'll be virtual reality simulators there, and we also have an additional 40-seat classroom. Okay, so I just want to wrap up now, and I want to wrap up by turning our attention to community and people. Everything that, all of our successes and everything we do depends on our community, our staff and our faculty and the students that we are serving, and of course the patients. But I just wanted to point out, in terms of the position that SUNY is taking in response to the executive orders and actions that are basically targeting diversity, equity, and inclusion, that we return to our mission, which has been in place for 75 years. So since SUNY's founding in the 1950s, it's part of its charter that the mission is to provide to the people of New York educational services of the highest quality with the broadest possible access, fully representative of all segments of the population. This reflects a foundational concept in our mission, which is we want to build a strong, diverse, and inclusive college community that reflects the populations we serve. That's fundamental to our mission. So I want to just reaffirm for everyone here and for the community that we are committed to building a diverse and inclusive college community that reflects society and the patients we serve. We will always expand the student applicant pool by reaching out to qualified students who may have not considered optometry as a career path. And we will continue to ensure that all students, especially those who are economically disadvantaged, can fulfill their potential. We will foster a sense of pride and ownership in the college mission and a sense of belonging to the community of eye care professionals. I think that's a critical point. We will develop communication skills within the community for civil discourse on divisive topics. And finally, we will always serve the underserved and economically disadvantaged by making eye care accessible. And just to finish up, I want to congratulate, oops, what happened? I want to congratulate some people on their promotions in 2024. This is in the last year. Wayne Spencer has become director of the Clinical Vision Research Center. Monica Guerrero, referral service manager. Terry Jackson, assistant manager in primary care. Daria Harrison, internship and community outreach associate. We've got teaching hospital staff assistants, Maria Mejia, Christian Panora, Miriam McLean, Caitlin Delgado, and Gertie Polanco Torres. Sorry if I messed up your names. Among the faculty, we've had a number of promotions as well. Golnoza Azieva has been promoted from, she was resident, assistant clinical instructor to clinical instructor, which is a faculty position. Alexandra Benavente Perez has been promoted to research professor. Sarah Gleason promoted to associate clinical professor and has taken on the upstate program director. Shelby Johnson, associate clinical professor. Jill Locasio, librarian, that's equivalent to a professor in the library space. Stephanie Wall, associate professor with tenure. Nazia Taiya, sorry about that, clinical instructor. Travis Pfeiffer, clinical instructor, and Tracy Wynn, who is now clinical professor and has been doing an amazing job stepping in as interim vice president for academic affairs. So thank you all, and congratulations. And so thanks to all of you. The college is strong. We will continue to lead, building careers, innovating and discovering and providing eye and vision care. And by working together, we can overcome the challenges that we will face, whether they're budgetary or political. I would also like to thank the President's Council, working with everyone there. They've helped me pull this all together, helped me get a broader, bigger view of everything that we do here. And so I work with these folks every day, and I'm grateful for all of them. And then finally, our sense of community and common purpose is how we succeed. So I want to thank everybody for coming today and paying attention to this as I kind of meandered through everything that we do. So grab some lunch, grab a box of lunch, have it here or take it to your office or your desk and enjoy. So thank you again.